Hello, this is Jonathan White. I'm a surgeon here at the Royal Alexandra Hospital in Edmonton, Alberta. And today I'll be talking about life after COVID, reflections on a global pandemic. So here we are, it's August 2021. Who would have thought we'd made it this long, almost a year and a half after COVID-19 got declared. And I thought it was a good point to kind of stop for a minute and reflect on where we've been over the last 18 months or so. Kind of look back at what we've learned from COVID and consider what's coming next, possibly. I do have one concern, which is to say, it's a bit too early to be commenting these things, I suppose. The pandemic's not over yet. They've still got some road to run here. And I'm reminded of Mao Zedong when he was asked about his thoughts on the French Revolution. They asked him in 1971, and he said it's a bit too early to tell. So I do feel some anxiety about talking about COVID-19 before it's quite finished yet. The other person I'm thinking about is Abraham Lincoln in his letter to the widow Lydia Bixby in 1864. He said, "I feel how weak and fruitless must be any words of mine which should attempt to beguile you from the grief of a loss so overwhelming." A lot of us have lost a lot over the last 18 months ago. So I'm sensitive to that as well. It's been a tough time for all of us, especially in the medical community. So some of the wounds are still a little bit raw when it comes to COVID-19. As I say, it's not over. This is a headline from the Calgary Herald just a couple of days ago, where we're predicting a fourth wave of COVID-19 here in Alberta. So definitely not quite done with us yet. I think we do have to reflect on 2020. This is the birthday card I got my wife this year, just to celebrate how awful 2020 was, what a really shit year it was, and how we need to put it in the shredder and move past it. So far, 2021's been a much better year than 2020, but I want to recognize for a minute just how much we lost last year. This talk is inspired a little bit by a book by Fareed Zakaria, who's got a weekly show on CNN that I watch, The Global Public Square. He listed 10 lessons for a post-pandemic world, and I recommend this book to you. So he said the 10 lessons are: buckle up, the quality of government matters, markets are not enough. You see the rest of them there. We are social animals, inequality will get worse. The world is becoming bipolar, and sometimes the greatest realists are the idealists. So I think you'll see some of these lessons kind of reflected in my talk today. I wanted to ask you for a minute, do you remember life before COVID? Do you remember the before times? Remember when you could walk into a hospital and you didn't have to wear a mask? Remember where you could go close to other people and maybe get them a hug, or maybe like stand close to them and be in the same space as? I remember when we used to get on an elevator together, there's like 10 people in the elevator and everybody squeezing in together like sardines. Remember, like these people in Grey's Anatomy, they were so confident, they were so sure of themselves. Look at how white their white coats are. Look at how blue their blue scrubs are. These people were gods. These people were amazing. These people were super confident. And I think this is how we were before we were humbled by the global pandemic, I think. So I sometimes can't remember life before COVID on some of my bad days here. I wanted to take a minute to just reflect on the shared experience of what COVID-19 has been like for all of us before we got to know this darned little virus that we all hate so much. There was a time before this when we didn't wonder what the number was every day, right? We didn't know what curves were what we didn't have to be, all had to be armchair epidemiologists. We didn't have to flatten curves or worry about if they were going up or down, or what the stages were, or what the wave was, or any of that stuff. So we've all become junkies to some degree on epidemiological data, wondering what's going to happen next and taking some reassurance or some fear from whatever the number is today, hoping it'll be less for tomorrow. Most of us, I think, by now know what it's like to have a COVID test. We know what it's like to have somebody stick a Q-tip into the back of your brain almost. It feels like it's very unpleasant. I've had it done one time and I never really want to have it done again. So we've all been through that. A lot of our patients have been through that as well. Yuck. We've all discovered the pleasure of Zoom, right? I remember when I used to go and have coffee with people when I would meet with them, and we'd meet together in somebody's office or in a coffee shop somewhere. I can't remember the last time I did that. It's just Zoom, Zoom, Zoom all day long now. Sometimes it's well, I think my biggest meeting on Zoom was 700 people on Zoom. It's kind of overwhelming sometimes how many people you're looking at and how many people are looking at you as well. And Zoom existed before the pandemic, but really the pandemic brought it to the fore and made it something special and an extra, a useful tool that we'll talk a bit more about in this presentation as well. PPE, you know, how many times have I put on that darn yellow gown and forgotten to tie it at the side, or if I had to put my gloves on, or I've had to take that little plastic membrane off the eye shield and everything, and I've had to, many times have I had a mask on and off over the last 18 months. Like PPE is very good for us and we have to keep doing it, but it's a real pain in the ass. And there's 1,000 other little things that I could tell you about, or I've become afraid of doorknobs in the hospital. Like I've got a categorization now. If you can work a doorknob with your elbow or your shoulder or your butt, or some way to open it with your body without touching it with your hand, that's a good thing. And if you got to touch one of those horrible round doorknobs with your hands, it's a dangerous thing in case somebody left COVID on it. And I bet you have your little pet things, or one of the 1,000 other little things that have annoyed you over the last 18 months. And if you do, I'm with you there, certainly. I share your annoyance. We've all become afraid. We've all experienced fear in a way that we hadn't before, or at least in a way that I hadn't before. Think about the things you're afraid of. Like we were afraid of dying, catching COVID ourselves and dying. We were afraid for our colleagues. Maybe our colleagues would die and we'd be left alone in the hospital. Be afraid of our patients catching COVID and dying. I was afraid of bringing COVID back to my family and giving it to my wife or something, right? Like I'm going to be the vector when I come home again. We were genuinely afraid of other people. Like we were told, stay 6 feet away from them and don't get too close and wear your mask at all times. So other people, especially strangers, became dangerous and became unknown, and we mustn't go close to those people. It's just terrible. We became afraid of the hospital. We became afraid of going in there, and that's where the virus was, and that's where the patients all were, and it's a horrible place and we shouldn't go there anymore. We became afraid of everyday activities. My wife didn't go to the store to shop for a good 6 months. She would send me in as well because I was already compromised and I was at risk because I worked in the hospital. So she was afraid of going to the store, and all these normal things that we did all the time suddenly became fearful and to be avoided. And we lost a lot over that. And we were afraid, and we're still afraid, I guess, that it will never end, that COVID will be here forever and the restrictions will never go away, and that we'll never be in a hospital without wearing a mask again. So many things we were afraid of. This is a direct quote from a colleague of mine. And my colleague said, "Can you round for me today? Can you go and see my patients for me today? I don't want to be in our virus-infested hospital." Like, that colleague of mine was really afraid of going in, picking up the virus from the virus-infested hospital and bringing it back to their family. And that's how a lot of doctors have felt over the last 18 months. It's a little bit better now, I guess, but at the height of this thing, we were very afraid of simple act of going to work. We lost a lot as well. I mean, and I'm separating this out from losing people and losing patients to COVID itself, which is horrific and perhaps the worst loss, of course, but there were other less tangible things that we lost as well. We lost our purpose. We didn't know why we were going in anymore because all of our clinics were cancelled and all of our operations were cancelled. What are we going into the hospital to do if we're not actually allowed to work? We lost control. We weren't in charge of our lives anymore. There was this unknown virus out there that was doing things to us and changing our practice and changing our lives. We lost our agency, this sense that we are in charge of our direction and we're able to chart our own course. Also, agency is about being able to make a difference. We felt that we were powerless. We felt that we were not able to change anything and that we were just on the horns of a dilemma, and something would happen tomorrow that would take us in a new direction. So we lost purpose, control, agency, this sense that we've had over many years of being in charge and knowing what to do next. We lost our connection with others. All those social interactions we have and all the times we meet with friends and go for dinner and go to a party, all that went away. We lost our ability to work. As I say, a lot of our purpose was taken away because the things that we normally do went away, and our routines went away as well. Normally, I only know it's a Tuesday because I'm in the colonoscopy suite. I only know it's a Thursday because I'm operating, and our routine went away, and it still hasn't come back. And hopefully it does sometime soon. We also lost the ability to escape from work. A lot of us, myself included, we might work for 3 months at a time and then go on a vacation, and then another 3 months of work. You know, when you're in the city, you're working hard, and then when you're away, you're not working at all. And that ability was taken away. I've now had 3 staycations, and they've been the first 3 staycations in my life because we haven't been able to travel. And I'm learning how to escape from work while actually staying physically here in the city. So we lost that ability to escape. We lost our trust in others because we didn't know if they had been following the guidelines or not. We didn't know if they had symptoms or not. We didn't know if they'd reported those symptoms or not. And we find that with our patients too. I know at least one case of a patient who lied about their COVID status, came into the operating room and actually put a lot of the team on quarantine for a couple of weeks because they had told a lie about their COVID status. So when a patient does that to you, you start to wonder, well, if you're not looking after me, what am I supposed to do with you then? You know, how altruistic can you feel when a patient takes advantage of you like that? So some of us lost our sense of altruism as well. And then we were witnessing the effects on the larger society as well. So we're already, at least here where I live, we're already a fairly unequal society, with a lot of people at the top doing very well and a lot of people at the bottom really not doing very well. So those inequities got worse, and we saw a lot of adverse effects on people in the lower end of the socioeconomic scale, or people who were homeless as well. It was very difficult for you in this situation if you didn't speak English, if English wasn't your native language. How are you going to get care? And how can you go through the whole COVID symptoms if you don't speak the language? There was this sense of being a frontline worker that we had, when people were so pleased and so supportive. And I had a lot of patients contact me and say, you know, we're rooting for you, Dr. White. So fantastic you're doing this work in the hospital. But also the frontline workers like the cleaners and the people who drive the buses and the people who do all this work that you can't do from home. If you're an office worker, fine, you can boot up your laptop from home, I guess. But a lot of frontline workers who aren't healthcare workers are not actually able to do that. And they're just as brave as healthcare workers, and I think in some cases even braver. The other thing that I noticed is we saw the cracks in society made more visible through social media. And I didn't realize how many crazy people are out there until this happened. I didn't realize how many anti-vaxxers there are, or people who don't believe in science or evidence. And the COVID pandemic has really brought those people up to the surface so you can see them. And I'd almost rather that I couldn't see them sometimes. So it's been a real time of rapid change the last 18 months and fairly unexpected. And I'm going to quote Lenin. Lenin said, there are decades when nothing happens. And then there are weeks when decades happen. And it certainly seems like the last 18 months has been a period of rapid change. And a lot of those changes are established now and are not going back. We did, however, prove that we're able to act fast to get important things done, like world record development of a vaccine, obviously. And generally, we can act together when the purpose is clear. When we had to, we were able to put in restrictions and stop the curve from going up and flatten the curve and bring it down again. So it's pretty clear as a society, we can actually act together and make major impact when the purpose is clear, and we've all got a reason to work together, which is what we did with COVID-19. So I recently asked a bunch of my colleagues, what's the worst thing about life during COVID? What was the absolute one thing that you couldn't stick during COVID that really made your life unbearable? And I'll give you 5 seconds to think about this. Okay, it's just like on Family Fortunes. Here are the top answers. Our survey said the worst thing was isolation, like feeling separate from others. No hugs, no meetings with people, no events to distract us from work, no travel. Zoom was one of the worst things about the pandemic, no escape, and a constant sense of anxiety. So that's a list of the common things that medical professionals that I know said were the worst things about the pandemic. The other question I asked them was, name something you started during the pandemic you want to keep doing now it's over. So I'm going to give you 5 seconds for that as well. Something you started during the pandemic that you want to keep doing now that it's over. Not that it's quite over yet, but in the future. Okay, our survey said slowing down, connecting with other people, spending time with the family, visiting other people, having some balance in your life, exercising, having hobbies, and like me, meditation as well. Those are some of the things people started during the pandemic they wouldn't have started otherwise, and they're now hoping to keep it going afterwards. So let's talk about then what life is likely to be like after COVID, if we ever get to after COVID, or once COVID becomes endemic and becomes just another respiratory disease, I guess. So there is this large amount of tension between people who want to go back to the way it was before, like exactly the way it was before, to the before times, and people who want to move forward and say, well, some things have changed and now we're going to move forward with those things as well. So I think there's a lot of tension, there's a lot of conflict over exactly what's going to happen next. Like, do we go back to exactly the way it was before? Because I think looking back on it now, there are certain things about how we were living in the before times that weren't very good, and we were able to see them during the pandemic, and maybe we can tackle them now and make them better, maybe even make them go away in the future. So I'm not 100% sure I want to go back to exactly the way things were before. I think actually there are certain things I've learned during the pandemic that I want to keep in place, like some of the people we looked at in that survey before. Here's an interesting book called The Power of Habit. And in this book, essentially, it talks about setting up habits, trying to say, well, I want to eat better, or I want to stop smoking, or I want to do some change in my life. How do I set that up through habits so that I can kind of train myself to do this new thing? But it applies the other way. It applies in losing habits as well. So it probably takes 3 or 4 months to establish a habit, 3 or 4 months to lose a habit as well. So if the pandemic had only been for 3 or 4 months, it would have been easy enough to remember what we were doing before and go back to our old habits. But it's been long enough now that those old habits are broken. So we don't have to go back to them. In some ways, it will be difficult to go back to them. In some ways, the before times don't even exist anymore, because all the old things we used to do have been gone for long enough now that we're going to have to do something new. So I just point that out. It's been such a long experience for us that the old ways of doing things are not necessarily ingrained in us as strongly as you might think. I wanted to talk briefly, as I said I would do, about Zoom as well, because it's really become a part of our lives now. So Zoom is totally awesome, right? It is convenient. It's free. You don't pay for it. It's accessible. You can get on your phone or your laptop or wherever you want, really. We have noticed that attendance rates are through the roof at all the meetings that we're having. Often we would have to have a meeting in a room somewhere, right? So somebody would have to drive from wherever they were to the building and then get to the room and everything. And we never got everybody to come because people were away or whatever, or they had other commitments. But we're noticing people are attending Zoom meetings now in their car or on the bus or from home. Like one of my colleagues actually cooks dinner for his family while he's on the meeting with us, which is just awesome. So attendance rates really are through the roof, and that's because it is more accessible. It's easy to use. There's no need to commute because you can do it from wherever you want. I used to have to get up at 5 a.m. to be at the airport at 6:30, to be on a plane at 7 o'clock, to be in Calgary for 8 o'clock, to be at a meeting for 9 o'clock. And now I can get up at 5 to 8 and just 5 minutes later I'm on the meeting, right? So there's no need for commuting anymore, and there's no need to fly anymore. Like that Calgary flight doesn't have to happen anymore. And when I was flying to Ottawa, apart from the time difference, I suppose there's no need to be physically present in Ottawa. As long as I get the time difference right, I can be present from my home here in Alberta. So it's changed the nature of meetings. It's changed where you have to be involved in a meeting. So in some ways, Zoom is just fantastic. The other side of the house, though, is it's very deliberate. You can't bump into somebody in the coffee line on Zoom. So, I mean, you have to send an invite, you have to set it up, and it has to actually formally happen. It's a deliberate thing. It's not super spontaneous or random. It is highly, highly, highly visual. It's all about seeing and being seen. And I mean, it's actually, some of the theory behind Zoom is quite interesting. I mean, you're looking at the other people and they're looking at you, and you know that they're looking at you. So you start to think, well, what are they seeing? You know, and do I have the right pair of glasses on, or do I have the right shirt on, or what does my background say about me? Your background does say a lot, actually. I think some of our native biases are coming out actually underneath all of this. We're making judgments on people based on what their Zoom background shows. There's a site that my wife likes called Rate Your Zoom Room, where you get a mark out of 10 as to how good your Zoom background is. And we're starting to do job interviews on Zoom as well. And I'm wondering whether sometimes the background makes a difference, or what the person allows to be shown in their background makes a difference when you're making an employment decision. So there's a lot of information comes through the visual channel, not all of it we're aware of all the time. Empathy is definitely an issue. And I've seen people say things to each other in a Zoom call that they would never say to each other if you were in person with each other. Because if you say a hurtful thing to somebody on Zoom, you can turn your camera off, and you don't even need to look at the screen to see the impact. If you're in a room with somebody and you say it to them, you can see the tears in their eyes, you can see just how much you've hurt them. And I think Zoom allows us to remove ourselves from each other in that way. And I've seen certainly a lack of empathy in some people on Zoom calls. Whenever we used to meet in the real world, we used to have to walk between meetings. I would go to the university, have a coffee with somebody, and then we'd finish and I'd walk over to somebody else and meet again. But on Zoom, there's no requirement to have downtime. So you can finish one call at 9 o'clock and start another call at 1 minute past 9, and away you go as well. And we are working ourselves to death, I think, on Zoom. And I've certainly done meetings where I had like 11 hours of Zoom calls in a single day, and that's not fun at all. Running a good meeting on Zoom is a totally new skill set, and I've seen some fairly senior people do a really bad job of chairing Zoom meetings because they think they are chairing like a regular normal meeting. They haven't really adapted to the fact that they're in a different online space. It's a totally new skill set. When you see someone run a good Zoom meeting, it's just awesome. When you see somebody run a bad one, it's pretty terrible as well. So we need to step back and think about how we're using this tool. The other thing about Zoom is I don't think it's going away anytime soon. I think it's a useful enough tool that it's going to be staying here for the foreseeable future. So I think we have to start to get used to some of its limitations. And I think we also have to maybe train ourselves a bit better for it, to use it with better intent sometimes. So this is some tips that I picked up from an article from, I think it was Stanford, group of Stanford, about how to use Zoom a bit better. Just kind of, these are rough and ready tips. So first thing is turn self view off, because then you can't see yourself. And then it reminds you that you're not going to have other people looking at you the whole time. So I've certainly been on calls sometimes, and there's been this guy in a blue shirt with glasses talking all the time. And then I suddenly realized, gosh, that's me. So it's a slightly strange sensation of seeing yourself on the screen live. There's some work that suggests that if you have somebody with a face that gets into your personal body space, like 2 feet away, that can be threatening. So if you're looking at a single face on Zoom and it's close up to your face, that your body can, like your subconscious can interpret that as a bit of a threat gesture. So probably you're better to step back from the screen a little bit, move at least 2 feet away from your face so you're not getting intimidated by these big faces coming at you. Sometimes you should just turn your camera off. Or maybe just minimize the screen and just listen. Like take the audio aspect of it away completely and just listen. I find certainly when I'm on big calls, sometimes I'm not leading the call, I like to do a kind of a distraction activity where I'll do some laundry or I'll empty the dishwasher or something else useful. And it's what we always used to do when we were on phone conferences. We would do something else to distract ourselves. It's actually a slightly creative way to get your mind doing something else while you're listening to somebody talk. So if you're ever on a call with me and you hear some dishes or some cutlery rattling, I'm probably emptying the dishwasher. Some people have actually suggested you should do a virtual commute. Like you should say, well, I'm not having my first Zoom meeting till 8:30 because I have to drive to work between 8 and 8:30. And they're actually scheduling time to kind of get ready for the day and to organize yourself before the meeting starts instead of just starting at 8 o'clock. And I think more and more of us are actually going towards just having a phone call instead, especially if it's a one-on-one Zoom. And it's so nice just to be using one sense, like just listening to somebody, like really listening to somebody and not being distracted by their children in the background or their wallpaper in the background or whatever Zoom virtual background they put on today. Just to have a phone call with somebody is strangely liberating in these strange times. The big question, of course, is what are we doing with those in-person meetings? And are they coming back again? Like at some point, are we going to go back to having the normal meetings we used to have? What about big conferences? What about getting thousands of people together in a big venue in Toronto or Ottawa or something for a big national conference? A friend of mine actually was at a book festival last year in Banff. And she said it was one of those things where, normally you would have to like drive to Banff and get a hotel room, which is expensive because it's Banff, and stay a few nights and pay the registration fee for the conference. But in 2020, none of that applied because the whole thing was online and it was free. And she was able to attend and see all these things and hear all these people that she hadn't heard before. And she's afraid that next year we're going to go back to this privileged few attending the meeting and having to have the money and the time and an employer who will let you take off so you can travel down to Banff. So there's a certain amount of privilege to being at these in-person meetings. And certainly online meetings are much more open and much more accessible, and there's much more equity actually in an online meeting there is in an in-person meeting. If you look around the board table on this slide, this is mostly middle-aged white guys, right, getting together with their high technology and their big board table. But if you count them up, there's only 20 or 25 of them, I guess, around the table. It's quite a small group. So I think the question that I don't have the answer to going forward is, are we going to be having hybrid meetings, like some people attending online and some people attending in person? Will it be just the privileged few who are allowed to attend in person? And how do you assure that people who are attending online have the same voice as people who are attending in person? Or are they just observing? Are they like a second class person at the meeting? So we don't have a good answer to those questions at the moment. I think we've learned that virtual care is here to stay, though. And I think a lot of us have been using things like phone call follow-ups and Zoom and a variety of different platforms to do virtual care. At least in my practice, it's turned out to be simpler than I imagined, because I thought at the beginning of this pandemic thing, we would all just be on Zoom, right? I'd be in my office and like this guy is, and then the patient would be at home and would be talking like this over the laptop or whatever. But in fact, it turns out most of my patients don't want to be on Zoom. And when my assistant, Tracy, asked them why, they said, well, I want to see the doctor, but I don't want him to see me necessarily. Like, I feel like when I go to the hospital to see this person who's in a position of privilege and authority, I have to kind of dress up. Like, I have to get my hair done, or I have to put a dress on, or I have to like wear a tie or something, right? And I don't want to have to do that. But I'm happy to talk to him on the phone, because when I'm on the phone, I can be in my sweatpants or in a t-shirt or whatever I want. And I'm much more comfortable with that. So I think I've done a vast number of phone calls over the course of the pandemic, and actually very few Zoom calls, because that's just the patient population that I have. That seems to be their preference. Maybe as we go forward, more people will want the Zoom option, but at the moment for me, it's been mostly phone calls. The other thing about virtual care is teaching virtual care is a totally different skill set. Like, I think I've probably done 1,000 phone calls over the course of the pandemic. I haven't had a medical student with me on a single one. New patients or follow-ups or whatever. I'm not sure how to teach on a phone call. I'm also not sure how to give the phone to the student and let them have the phone call as well, to manage the consultation time in an efficient way. So I think there's a lot of work has to be done around setting up a framework for teaching virtual care, because same with Zoom, it's a totally different skill set than actually just seeing people in person. I want to finish up by talking about work, really. I think the pandemic has changed our relationship with work in medicine. It's changed what we do, it's changed how we think about it, and it's gone on for long enough now that it seems pretty likely that some of these changes, at least some of the changes, will be permanent. And as I said before, as much as we would like to go back to the before times, they're not really there for us to go back to anymore, because it's been long enough that they're well and truly gone. And if I think about wellness and balance, I think reflecting on how I was living and working before the pandemic, looking back at it now, it seems a little bit nuts. And I'm not really sure, as I said before, that I really want to go back to the before times exactly the way that they were. I think a lot of us have rediscovered this thing called home that we had before, but we didn't really appreciate or enjoy. I mean, it was a place where you came home to have your supper and watch some TV and sleep. Then you got up and you went back to work again. But all of us through the course of the pandemic have been forced to slow down. And we've actually had a standard phrase that we've used. We've said, I'm going to try to stay out of the hospital today. And if there were days when we didn't have to go to the hospital at all, or someone would cover for us, that was really, really positive thing. Because as I said before, the hospital has become a threatening, slightly dangerous place. So therefore, I'm going to try to stay out of it. And when I'm not in the hospital, well, I must be at home, right? So I've been actually spending time in my house. I've been cooking, I've been baking, I've been developing my hobbies, I've been, playing the banjo a bit more, exploring board games, that sort of thing. I think a lot of us have actually been forced to initially, and now are starting to enjoy spending some time in our house and thinking, I've been missing out on some things here. It's not just a place to sleep and eat and refuel and recharge and go back. This is an actual quote from a colleague of mine on the subject of burnout. My colleague said, I'm actually glad that the pandemic happened to us because it gave me a chance to take some time off. Like I needed to take time off, but I couldn't think of a good excuse. And when the pandemic came along, that was my excuse. So I welcomed it actually. So I wanted to talk a bit about work and burnout for a minute. So I think if you look at us before COVID-19, we were pretty burned out already, and just through the normal course of medical work. And at this point, after the pandemic, or at this point in the pandemic, we're just exhausted. We're totally done. Like the little needle is right on empty in our fuel tank. I don't know anybody who's not irritable, who's not tetchy, who's not grumpy, and who's ready to be done with this fucking pandemic, really. We got this note from the hospital recently. It said, the hospital is concerned about the mental health of our medical staff. They're advising we all take some time off over the summer. Things are bad when the hospital administration notices there's a problem. Things are bad when the hospital administration says there's a problem with your mental health and you should take some time off. To me, that's a big red flashing light on the dashboard. Hemingway said, the world breaks everyone, and afterward many are strong at the broken places. So through the course of the pandemic, I've started to think differently about burnout. I used to think it was a problem. If you were strong, it wasn't an issue, but if you burned out, you had to address it in some way, right? It was like a problem that needed to be fixed. Now I think it's actually not unusual at all. It's a pretty normal response. I think it was a problem before the pandemic, but now after the pandemic, it's going to be huge. It's going to be absolutely enormous. I think I saw a survey recently that said 2/3 of doctors described symptoms and signs of burnout. And I suspect the other third were just in denial. So I think burnout is an occupational hazard. You're going to get it if you practice medicine for long enough. We need to work to anticipate it, recognize it when it happens, and address it, because pretending it's not there isn't going to work for very much longer. So I think as the pandemic wraps up, we need to use it as a pause to stop and reconsider our relationship with work. And the questions I would ask are, do we really want to keep going like this? Do you really want to go back to the before times and just keep doing the same old thing, hoping for a different result? And if we did want things to look differently, what might they look like? There's a recent book from Gillian Horton, and I would agree with Alan Alda at the bottom there, where he says it's brilliant. It's called We Are All Perfectly Fine. And it's a memoir of love, medicine, and healing from a Canadian physician. If you haven't read it, you should. I think it's an extremely interesting piece of work, and I think it is something to say to every single physician who's practicing today. I'll talk briefly about masks before we're done. I wanted to kind of say how sorry I am, but I think that it's likely that they're here to stay in healthcare. I don't think we're going to see the end of them, and I suspect we may be wearing masks routinely for many years now, potentially. The nice thing about it is that, here in Alberta, partly because of masks, maybe some other factors as well, we had no cases of the flu last year, like 0 cases of the flu. Now, maybe COVID just kicked the flu's ass, and that's the reason why, but we had 0 flu cases. And it's been the most effective anti-flu strategy ever. It's much better than flu vaccination. We never got to 100% flu vaccination. So I suspect when you look at that, and if you say masks were part of that, maybe we should keep wearing masks just to keep infectious diseases like the flu away. I suspect a lot of people, even if it wasn't made mandatory to come into hospital with a mask on, I suspect a lot of people are going to keep wearing masks anyway. So I think they're probably here to stay for the foreseeable future. I think it's a bit sad, but there is definitely an impact on interpersonal communication, and there are a lot of things we say with the bottom half of our faces, with our noses, with our mouths, with all the muscles in the lower half of our face. And I've certainly noticed this with patients and with colleagues sometimes. I say something and I'm trying to be funny and they don't smile. And it's because we're losing that nonverbal communication. Or I come in and I tell a patient good news and the patient and his relative are completely stony faced and I can't see they're smiling underneath their masks and they're not smiling with their eyes for some reason. So if this is the case, if masks are going to be with us for a long time, we're going to have to figure out how to work around that. We're going to have to figure out what impact it has on interpersonal communication and how we can get our communication skills back again if you're not going to be allowed to use the bottom half of your face routinely. And I do mention that even after COVID has passed, even after the worst of the pandemic is gone, we're still going to feel a certain amount of distance between people and isolation between people. Because it's been 18 months now, we've been staying away from other people. I get a bit worried when somebody comes too close to me now. You know, we're out at a restaurant or we're at a show or something, somebody comes a bit too close with no mask on, I start to get a bit jumpy, you know. So I think it's going to take a while for that to wear off and for us to feel like a society again and to feel like a community again, whenever we've been trained over the last 18 months to stay away from one another. So it's going to take a while for that distance to wear off. I wanted to finish with a recommendation from an article I read on CNN. This was back at the end of May 2021. And they said, don't just go back to normal. Post-pandemic life can be much better than that. And I would ask you to have a think about how your life will be different after the pandemic in a way that it wasn't in the before times. And I would encourage you not to go back automatically and routinely to the before times. I think you should give it some thought about what you're going to do. The lessons that CNN, this author on CNN suggested: number one, keep your family close and your work should be more flexible. Number two, focus more on your mental health. And I talked quite a bit about burnout. Number three, a bit like Fareed Zakaria said, embrace adaptability, because there's been a lot of change come already and there's probably some more change coming down the line. Number four is express gratitude, like the things that you are grateful for and thankful for in your life. Tell people that. I think that's a very positive thing to do. And then number five, as we're seeing with a lot of the climate change issues at the moment, once this pandemic is done, we're going to have to go to work on some other major important tasks. I think we've seen that we can work together to do important things with COVID-19. So we're sure as hell going to have to work together to improve the planet and fight climate change. So thank you very much for your attention. If you've got any questions or you want to discuss this further, you can certainly find us on Twitter at Surgery101, or you can just drop me a line, jswhite1@ulberta.ca. I hope wherever in the world you're doing well. Stay safe, and thank you for listening to Surgery 101. We will see you again.